Angelo, thank you. Well, continuing our discussion now of COVID-19 and the Delta variant, we're joined now by a professor at Southern Connecticut State University.
Sarah Crawford is a biology professor and a virologist. Thank you so much for being on the news at 5 today.
I'm very pleased to be here.
All right, so tell us what our viewers need to know about the Delta variant. We know it's more transmissible than the original form of COVID, but what you're seeing as a virologist, what do we need to know?
Well, we're seeing quite a bit. Unfortunately, we have the pattern that was established in the UK, where they showed that the transmissibility of the virus was greater than 50% higher than the original COVID. We also see that it's responsible for about over 80% of cases in the United States, and that the symptoms are different. It may be slightly more infectious, and we're seeing a significant number, not a great number, but a number of breakthrough infections as well. So this is of great concern to everyone, especially for people who have not been vaccinated, because they are at extremely high risk of developing this disease.
Well, let me pick it up right there, Professor. We have politicians and health experts encouraging everybody to get vaccinated, as you just did. Yet, we're also being told that we should wear masks even if we've been vaccinated, and I think a lot of people are confused by that. Clear this up for us. Do the vaccines protect people against the Delta variant?
Well, we're still gathering information on that topic. We know that there's a significantly decreased risk if you're vaccinated, but it does go up slightly as compared to other variants. In addition, if you do contract the virus, even if you've been vaccinated, the data so far show that you can transmit the virus just as easily as someone who hasn't been vaccinated, so that you can be a carrier of the virus and help this to proceed. So for your own safety, in terms of breakthrough infection, where we don't really have solid data, especially for the J&J vaccine, and also for the safety of others, and to help prevent the pandemic from spreading even further, even if you've had a vaccine at this point, it would be very kind and intelligent to wear a mask.
Now, does this variant have the potential to plunge us back into a shutdown like we saw last year, or have enough people been vaccinated where that can be avoided?
Well, I don't think we're ever going to return to a complete shutdown, because we know so much more about the virus, and we do have vaccines that are certainly efficacious. But the question is, how far is this going to go? And that's a decision that we as a country have to make. Are we going to continue to vaccinate? Are people going to be made more aware that this is so important? Are we going to take precautions or just have a cavalier attitude because we've already been vaccinated? There's always a very small but horrifying risk that a person, people who are vaccinated who get the virus may continue to mutate within those individuals to even higher levels of infectivity and to higher levels of resistance to current antibodies offered by the vaccines and immune protection. So it's something that we really have to think about very carefully, and we have to work together as a country, which I hope we can do.
So, Professor, in terms of working together, in terms of our personal responsibilities, we've talked about vaccinations and we talked about masks. What about some of the other preventive measures that we've talked about? Certainly, no question, washing your hands often would be a good idea. What about things like distancing that we were doing last year? Should we think about maybe not joining in big crowds as much? Maybe distancing at work a little bit more for now?
Well, I think, to err on the side of caution is smart. We want to be realistic. We want to be able to continue our daily lives. The governor just came out with a directive today where he's still considering what should be done in the schools, for example, what kinds of mandates may become necessary. The state incidence rate is now at 3%. So we have to sort of monitor this on a day-by-day basis, and on an individual basis, use common sense and be as careful as you can in terms of going out socially and interacting with others in a way that is safe, and wearing a mask and being careful about some element of distancing. I mean, we have to live in the modern world. This is true. But unless more people, the state vaccine rate is not high enough yet. It's about 60%. Unless more people get the vaccine, we're going to be facing this issue of further viral infections, escalation of situations that may be reminiscent of the pandemic last year. And we really have to work together. And I hope that people are sufficiently cautioned by this uptick that if you haven't been vaccinated, you'll get your vaccine. If you are vaccinated, don't assume that you can't get COVID and you can't spread COVID. And from there, use your judgment. And I think personal judgment and integrity is going to be an important player in seeing how this plays out in the future.